preface it with something you may not have heard that I said this morning, which is this is intended and will be an independent commission. Secondly, we intend to focus on terms of reference which I drafted earlier on, were all agreed, which was identifying the constituency that needs to be served, identifying the needs of that constituency and how they're best met. That can only be done if there is a transparent and honest debate, your point. Now, my concern is that a whole sector of the constituency is in fact excluding themselves because of fear. They're on your database. Now, we have already the 40, I'm talking about the 40 people. Now, they need to speak. They absolutely need to speak if we're going to progress at all, for the benefit of the community. Now, I don't want to put them in a position, and none of us do, in which we heard about one example this afternoon. That kind of harassment has to stop. However, bearing in mind, and it's a long introduction, I'm wanting, on behalf of the Commission, for your possible help with regard to those 40 or even more, because we have procedures. We can anonymise, but it can go further than that. If they're worried that what they have to say may identify which hospital they're in, well, we can deal with that as well. They want to deal with their observations or points in a general way, they can be dealt with. Now, I'm issuing this generally. Is anybody else here today who can help? Now, are you able, do you think, to go back to these 40 and see whether any of them will come out of the woodwork? Because at the moment, that whole area, we're realising, it's other people who are having to come forward and speak on their behalf. We do not want a situation at the end of all this process and say, well, you haven't got the information, you haven't got the practitioners on the ground and all that kind of thing. That's the point.
I mean, there are some of the commissions have been in this room today, and will show support by being here, but I can really understand some of their concerns. One thing I think would make a difference is if you could do some closed sessions, because that might reassure people. I'll certainly circulate anything you give and try really hard. I make it a priority to get people because I know that nothing counts as much as that. But you will know people like Charlotte Monroe and a whole lot of other health workers that have had a really tough time when they whistle-blown. And this isn't even really whistleblowing. This is telling. All I've told you, every single thing I've told you, is public information. I've got it from all papers, and people are quite nervous even about that. So, I will try really hard. Our organisation will. I would suggest that closed sessions might help a bit.
I'm sorry to have this debate in public, but I think that's what we want to be, in public and transparent. So, having closed sessions provides a real difficulty because, of course, you're not transparent. And then how do you publish what you've heard in closed session? So it's a difficult one. I think some of us would be reluctant to go down that route. What I'm really saying is you can anonymise observations as long as we're in a position to know who the people are. We won't. We'll give undertakings that their confidentiality will not be breached in any way at all. But there has to be an effort to, as it were, provide public information to give us insights from genuine practitioners. Anyway, that's all I need to say on that, perhaps too much. Anyway, anybody? No?
I think it's very clear, the presentation. Thank you very much.
Yes, thank you very much.